In this video, I'm going to talk a little bit about rehab for neck pain. It's one of the common things we see here in the clinic alongside back pain, and the principles between the two areas are actually remarkably similar, mainly because the problems that affect the two areas are again remarkably similar. So I'm going to go through the things you should not be doing. And a lot of people are doing these, so make sure you watch this video in its entirety to really understand why you shouldn't be doing these things. In terms of neck pain, there's common knowledge out there that doesn't always apply, and when we've got people maybe like you watching these videos on YouTube to try and find some sort of solution, chances are your case might be a little bit more complicated or you're making some of these mistakes. So first and foremost, nowadays, what are we doing on our phones every single day? We're down like that. We're watching Netflix in bed, on the laptop, or like that. We're on the tablet like that. We're on the tube in London or on the buses like that all the time. And all of these positions are this here. And that puts a lot of compression through these discs on the front of the neck. It stretches permanently the ligaments on the back, which loses the integrity of this nice shock absorbing mechanism that we should have, so the joints become vulnerable. And it also puts a permanent stretch through the muscles. If you're walking around like that all day with your arms stretched out, your biceps going to start to get tense. And it's important to recognize that the tension that you feel in the neck is not a cue to stretch your neck even further. My bicep will start to feel stretched or tense if I hold it like this for a long period of time, because it's overworking, it's in an elongated position and it's trying to contract. It's a mechanically disadvantaged position, and therefore it'll get very weak, very tired very quickly and feel tense. I do not need to stretch it further, I need to take the stretch off. And this is the biggest mistake that we get patients coming with neck pain. It's the classic chin to your chest, stretch like this because these muscles are tired. But if your head is going forwards all day, it's no wonder that they're tired, because the distance from here to here increases as we do that. So those muscles are held on stretch, which exerts more compression through the neck, and it becomes a vicious cycle. Patients will then frequently stretch even further and even harder, and it just perpetuates the problem over and over again. You really need to watch out for this particular stretch, because it's something that's often given to patients and it doesn't help. There's lots of videos on YouTube that go through that, and for a minor muscle spasm in the neck, yeah, it's fine. But if there's something more complicated going on, then it's not helpful, and if anything, it's counterproductive. It will make the situation worse. The next bit of advice is more so for the more slim people. We find that a lot of people that are very slim, particularly the girls that have done ballet or dance or gymnastics, those sorts of activities, have a very, very straight neck. And one of the exercises that's out there is the chin tuck. Pull the chin in like so. Now that exercise is fantastic for the characteristic hunchback old man who's shifting forwards, maybe not that old unfortunately, and really needs to pull everything back from the thorax almost. And that works really, really well. But the lady, or the more slim gentleman who's very, very tall with the head going forwards, might have a reversal in the cervical curve, which is not a good thing. We can touch on that later on in another video. And actually a chin tuck serves to straighten up the thoracic spine beyond what is normal, and that creates other challenges, which is why those sorts of exercises don't work. So I'm going to go through two really cool exercises that work for most people here. Try these at home, because they address those issues that I just discussed with you. And it's something that we get patients here to do. You have to remember, more or less all the patients that come into the clinic here, we've got images, we know exactly what's going on in their spine. And therefore we can tailor this advice to them, not just hoping for the best with something like a chin tuck. Okay? Number one is a cervical disc stretch. And this is where you simply lie on the floor. You lie on your back like so. A small rolled up towel here, about the size of a water bottle. And what that does, that gently provides support to take pressure off those discs and allow a little bit of respite for those load-bearing structures, rather than being upright all day, compressing down on those discs. It also stretches some of the muscles on the front of the neck that are often very, very tight, but not symptomatic. And it eases the tension on those muscles that we've discussed were under a lot of load because the head's going forwards. So that first one, doing that for 2, 3, 4, 5 minutes at a time, and then rolling off slowly, popping yourself up, works fantastically to ease the tension on the neck. The second one is an awesome little band exercise, and you can check this out on our website and even on the YouTube channel. I think this is up there under cervical extension exercise. It's essentially you have a band about where my collar is, and as you do the exercise, you gently being the key word, pull forwards and look up, pull forwards and look up, nice and slow, pull forwards and look up. And that just serves to just directly open out these disc spaces, and get that neck moving in the right direction so we've got a nice smooth curve through there, rather than leave you like that. It's a variation of a chin tuck, essentially, with a bit more specificity and more focus, so it's more helpful. Around about 15 gentle reps of that, and then lying on the towel really helps for a lot of patients with neck pain. Ultimately, if the neck pain is a little bit more stubborn, you need to go and see someone. So if you're in the London area, do please get in contact with us. We'll definitely be able to help you with that. If you're outside of London, you need to try and find someone that's got a more robust approach. So check out our website and understand what we do, and try and find someone that does something similar, or at least acknowledges a little bit more of a sophisticated way of dealing with these sorts of problems. So hope you found this video helpful. If you're suffering with neck pain or got any trouble yourself, please do comment in the comments below, what you've done that's worked, what you've done that hasn't worked, and you can always get in contact with the team at the Mayfair Clinic. So make sure, hit the subscribe button somewhere under here, and make sure you don't miss out on any future videos. And for any of the bits and pieces that I've mentioned in this video, like the disc stretch, like the cervical extension exercise, check out the YouTube channel in the exercises section, because we've got tons of videos there that'll help you.